Beautiful people. Are you struggling with infertility of any kind? Either primary infertility or secondary infertility, then this video is absolutely for you. Are you one of those already considering to use drug to conceive? Or probably your doctor has been talking about Clomid to you or Letrozole to you? Then this video is absolutely for you. Guys, do me a favor, share this video with your brothers, with your sisters, who you know needs tips or are believing God to conceive. In today's video, I will be teaching you how you can use Clomid / Letrozole for conception if your doctor is happy. Without wasting any more of your time, let's get to it. Alright guys, so welcome back to my channel. If you are seeing my pretty face for the very first time, my name is Violet Okolocha. I'm a registered nurse. I live and I practice in the United Kingdom. And in today's video, I will tell you everything you need to know about Letrozole and about Clomid. Let's start with Clomid. What is Clomid? Clomid is an ovulatory stimulant which helps to induce ovulation in women who wants to become pregnant. That's what it does. Now, how does Clomid works? Very, very simple. Clomid triggers the brain, the pituitary gland in the brain, to release more follicle stimulating hormone and more luteinizing hormone. This follicle stimulating hormone and luteinizing hormone will not even more trigger the ovaries to release more and more follicles. So these follicles grow and become a matured egg, and that's how Clomid works. Now, if you experience irregular ovulation or you don't ovulate at all, then your doctors might want to consider Clomid for you. Very simple. Nurse Violet, how do I know that I don't ovulate at all? Or how do I know that I have irregular ovulation? Very simple again. Your doctor is going to send you for what we call fertility hormonal assay. And in that test, it is going to show the level of your follicle stimulating hormone and your luteinizing hormone. Your doctor is going to analyze the result and then have a look at the result, might then see that the levels are low. If they are low, and will now decide to place you on Clomid. Now, a lot of women abuse this Clomid, and I don't encourage anybody to misuse Clomid. A lot of women have regular menstrual cycle, they ovulate properly, and they still go ahead to use Clomid. Now, if you misuse Clomid, you are going to be suffering from the side effect of Clomid. Now, what's the side effect of Clomid? Multiple pregnancy. Now, this is a side effect a lot of women like, but it is wrong to misuse the drug. You're going to have twin formation because when you take Clomid, when you have a regular menstrual cycle, when you know you are ovulating properly, what's going to happen is going to cause more than one egg formation. And when more than one egg is formed, the person could probably have twins, probably have triplets, and probably have quadruplets. Now, another question is, what is the success rate of Clomid? Now, the success rate of Clomid depends on a lot of factors. Number one, it depends on the age of the individual. Number two, it depends on the overall health of the individual. But overall, Clomid has 60 to 80% success rate. So meaning that Clomid is very effective. How do I take Clomid? Now, your doctors or your gynecologist is going to prescribe a total of 100 milligram per day. You cannot exceed 100 milligram per day. So your doctor or your gynecologist is going to prescribe 100 milligram daily for a period of 5 days. Now, most gynae or most doctor will prescribe 50 milligram in the morning and 50 milligram in the evening. But overall, you cannot exceed 100 milligram daily. And like I said, it's being taken, or your doctor will prescribe it for you for a period of 5 days. Now, another big question is, when do I start taking Clomid? Now, remember, guys, Clomid is to induce ovulation. Now, usually in a correct 28-day cycle, because you have to make sure you calculate your cycle, your gynae and your doctor will make sure you calculate, and they calculate your cycle with you. So in a constant 28-day cycle, they will prescribe you to start taking Clomid from day 5. Remember, it's to induce ovulation, so you take it before ovulation. Now, let's assume you have a regular 28-day cycle. When you minus 14 from a regular 28-day cycle, your ovulation is expected to be day 14. So if you start day 5 and you have to take it for 5 days, you can see that it's going to work before your ovulation. And that's the beauty. And now, a lot of people take Clomid day 5 in a 21-day cycle. What's the essence? Now, let's minus 14 from 21. It means you're expected to ovulate in a 21-day cycle on day 7. So now, if you start taking Clomid on the 5, it's not going to be effective because it's not going to really set it before your ovulation. And that is why you always need a gynecologist and a doctor to guide you. And such women could start taking Clomid by day 2 or day 3 with the doctor/gynecology advice. Do you understand? So that's how it works. Now, just like any drug, Clomid has its own side effects. Now, what are the side effects of Clomid? One of the side effects of Clomid is breast tenderness. The breast becomes very soft and very tender to touch. Another side effect of Clomid is mood swing. This morning you are happy. So anytime you are taking Clomid, your doctor is supposed to be monitoring you all through. This time you are happy and the next minute you are sad. The next minute you are smiling and the next minute you are crying. So mood swing. Another side effect of Clomid is headache, constant headache, nausea, vomiting. Now, guys, these side effects are not very regular, just like in all drug. All drug have side effects, but it's not like they happen regularly, no. But you just have to know the side effects. Hence, I'm telling you the side effects. Profuse sweating, dry vagina. The vagina becomes very dry, profuse sweating, blur vision. Now, there is one side effect of Clomid that is very life-threatening and that I have to let you know. It is very rare indeed, but I have to let you know. For people who misuse Clomid, it has a very rare, dangerous side effect, and that is what we call hyperstimulating ovarian syndrome. This can be life-threatening when it occurs. The person becomes breathless and they can only manage that person in the intensive care unit. Like I said, it rarely occurs, but it is very important I let you know. All right. So guys, I don't want this video to be very long. In another video, we'll continue with the use of Letrozole. Thank you so much for watching, guys. Please give this video a like. Give this video a thumbs up, subscribe to this channel, and do well to check out my video on menstrual cycle, how to calculate ovulation, how to calculate your fertile days. I'll drop the link in the description box. So go check it out. Until I come your way again, remain blessed. Bye, guys.